Mouth cancer, also known as oral cancer, refers to cancer that develops in any part of the mouth or oral cavity. This includes the lips, gums, tongue, the inner lining of the cheeks, the roof of the mouth, and the floor of the mouth underneath the tongue. Mouth cancer is one of several types of cancers grouped under head and neck cancers. Types of mouth cancer. The majority of mouth cancers are squamous cell carcinomas, which begin in the thin, flat cells that line the inside of the mouth and throat. Other, less common types of mouth cancer include verrucous carcinoma, the slow-growing form of squamous cell carcinoma. Salivary gland cancers, rare cancers that can occur in the glands responsible for saliva production. Lymphomas or melanomas, these can occasionally affect the mouth but are rare. Symptoms. Mouth cancer can appear in various forms and often presents with the following signs and symptoms. Mouth sores that don't heal, a persistent sore or ulcer, often painless at first, is one of the most common early signs. Lump or thickening, in the cheek, gums, or other parts of the mouth. White or red patches, these patches known as leukoplakia or erythroplakia on the gums, tongue, or lining of the mouth may indicate abnormal cell growth. Difficulty swallowing, the feeling that something is caught in the throat or trouble moving the jaw or tongue. Unexplained bleeding in the mouth. Loosening of teeth or changes in how dentures fit. Chronic sore throat or hoarseness. Numbness or loss of sensation in parts of the mouth or face. Ear pain without hearing loss. This may occur if cancer spreads deeper into surrounding tissues. If any of these symptoms persist for more than 2 weeks, it's important to consult a healthcare professional for further evaluation. Causes and risk factors. Mouth cancer occurs when mutations in the DNA of cells in the oral cavity cause abnormal and uncontrolled cell growth. Several factors increase the risk of developing mouth cancer. Tobacco use, smoking cigarettes, cigars, pipes, or using smokeless tobacco. Chewing tobacco, snuff is one of the most significant risk factors. Excessive alcohol consumption. Heavy drinkers are more likely to develop oral cancer, especially when combined with tobacco use. Human papillomavirus HPV infection with certain types of HPV, particularly HPV-16, is linked to an increased risk of oropharyngeal cancers, which affect the base of the tongue, tonsils, and throat. Prolonged sun exposure, this can increase the risk of cancer on the lips. Age, the risk increases with age, typically affecting people over 50, but can occur at younger ages. Gender, men are more likely to develop mouth cancer than women, likely due to higher rates of tobacco and alcohol use. Diet, a diet low in fruits and vegetables may increase the risk. Weakened immune system, people with compromised immune systems, such as those with HIV/AIDS or organ transplant recipients, are at higher risk. Diagnosis. If a doctor suspects mouth cancer, several diagnostic tests may be used to confirm the diagnosis and determine the extent of the cancer. Physical exam. The doctor will examine the mouth, lips, and throat for signs of cancer. Biopsy. A small tissue sample is taken from the suspicious area and examined under a microscope to detect cancerous cells. Imaging tests. X-rays, to see if the cancer has spread to the jaw or chest. CT scan or MRI, provides detailed images of the body's tissues and organs to check the extent of cancer spread. PET scan, used to detect cancerous cells throughout the body. Staging. Mouth cancer is staged based on how far the cancer has spread. Stage I, small tumor, localized to one area, less than 2 cm in size. Stage II, tumor is larger than 2 cm but smaller than 4 cm, without spreading to nearby lymph nodes. Stage II, tumor is larger than 4 cm or has spread to one lymph node. Stage IV, cancer has spread to nearby tissues, lymph nodes, or distant parts of the body. Metastasis. Treatment. The treatment for mouth cancer depends on the stage of the disease, its location, and the patient's overall health. Common treatment approaches include Surgery. Tumor removal. Removing the cancerous tissue from the mouth or throat. Neck dissection. If the cancer has spread to lymph nodes, some or all of them may need to be removed. Reconstructive surgery. After tumor removal, reconstructive surgery may be necessary to restore the appearance and function of the mouth, such as using grafts from other parts of the body. Radiation therapy. High-energy beams, such as X-rays, are used to kill cancer cells. It is often used after surgery to target any remaining cancer cells or as the primary treatment for early-stage cancer. Chemotherapy. Drugs are used to kill cancer cells or shrink tumors, often combined with radiation therapy for more advanced cases. Targeted therapy. These drugs, such as cetuximab, work by targeting specific proteins or genes involved in cancer growth, offering a more targeted approach than chemotherapy. Immunotherapy. For advanced cancers, immunotherapy drugs e.g. pembrolizumab may be used to stimulate the immune system to attack cancer cells. Prognosis. The prognosis for mouth cancer varies depending on the stage of the cancer at diagnosis and the patient's overall health. Early-stage mouth cancers stages I and II have a relatively high survival rate, with 5-year survival rates around 70 to 90%. However, advanced stage cancers stage II or IV have lower survival rates, especially if the cancer has spread to other parts of the body. Prevention. Several lifestyle changes can help reduce the risk of developing mouth cancer. Avoid tobacco. Quitting smoking or chewing tobacco significantly reduces the risk. Limit alcohol consumption. Drinking in moderation or abstaining can help lower the risk. HPV vaccination. Vaccines like Gardasil or Cervarix protect against certain strains of HPV, which are linked to oral cancers. Sun protection. Using lip balm with SPF and limiting sun exposure can protect the lips from cancer. Healthy diet. A diet rich in fruits and vegetables helps reduce cancer risk. Regular dental check. UPS. Dentists can detect early signs of mouth cancer during routine exams. Would you like to know more about specific treatments or support options for people with mouth cancer?